All right, we are here at the ASH 2025 annual convention. I'm Jeff Lancet, the chair of the Department of Malignant Hematology here at Moffitt Cancer Center, and I'm joined today by Dr. Sara Tinsley. Sara is a nurse practitioner scientist at Moffitt who has an interest in leukemia. But Sara, your interest also has been primarily in patient-reported outcomes and quality of life in patients with acute leukemia. Can you tell us a little bit about why that's important and how you're studying that in your current research portfolio and what you're presenting here at ASH?
Okay. Yeah, sure. I'm very happy to report some of my results. Became interested in studying the patient experience because we work together in clinic, and you would present this is the treatment I recommend. You walk out of the room, the patient would look at me and say, what does this look like? And so I became very interested in, the quality of life and the patient experience, which led to my research questions about what is the patient experience. And we have very little quality of life data, specifically in older adults with AML.
And what types of things have you learned so far with respect to the quality of life metrics and quality of life results in patients who've been treated with various forms of intensive or non-intensive chemotherapy for acute leukemia?
Okay, this has really evolved as we've been studying it. My first study was back in 2013, and I was comparing intensive chemotherapy with non-intensive chemotherapy and found that patients who were treated intensively actually had better quality of life, which busted my bias. I thought we shouldn't treat these older patients with intensive treatment because they get really sick, but we tend to remember the ones who are doing poorly. And so that busted my bias, and then I had to do another study to see if that was really right. And so I'm presenting at ASH a follow-up study where I studied patients longer, 6 months, and I compared intensive with non-intensive therapy for those 60 and older again. And I found the same results. Patients who were treated intensively actually had better quality of life compared to non-intensively treated patients, and had better survival.
That's a really interesting outcome, and certainly something that warrants longer follow-up and more detailed analysis. I also wanted to ask you about the possibility of intervention. So you're running or participating in a study where palliative care intervention is part of an acute leukemia patient's experience on the inpatient side. Tell us a little bit about that study and what the endpoints are and what we're doing so far.
Okay, this is a great study actually where we're part of a multi-institution study with Dr. Arij El-Jawari at Mass General. It's called the Scope Leukemia. And we were randomized. It's a non-inferiority study comparing primary palliative care, where they trained our inpatient APPs and some of our physicians in the core domains of palliative care, which is talking to patients, better symptom management, and comparing that to other institutions who were randomized to specialty palliative care. And so we're about 2 years into that, and it's great for the patients because, you're really trying to meet their needs.
So we're really going to learn more about the impact of palliative care and whether it can be delivered by specialists or people that take care of the patients every day, and
Yes.
how that makes a difference. Great.
Yes, and we had to take training for that. We have ongoing training every month.
So I think this just emphasized the importance of not just the advances in the therapeutic domain, but also really strongly emphasizing the importance of understanding the patient journey, the patient experience to really ensure the best outcome. So thank you.